You still have your Medicare card. It is in your wallet. It still has your name on it. It still says you are covered. But here is the question no one is asking. Does that card still protect you the way it used to? In 2020, 6 million of Americans will wake up and realize that while their Medicare Advantage plan was automatically renewed, the benefits they counted on are gone. The dental visits gone. The transportation ride to your doctor gone. That grocery card you told your neighbor about slashed or disappeared. And here is the worst part. Most seniors will not even know it until they try to use it. So how do you know what you still have? And what has already been taken? Let us break it down. Now, they did not cancel your plan. They just quietly changed what it gives you. And if you are not reading that annual notice of change, if you are just assuming things are the same as last year, you are setting yourself up for a very expensive surprise. Let us get one thing clear. Medicare Advantage is not being shut down in 2026. You are not losing your card. You are not being kicked out. But here is what is happening. The benefits inside these plans, the ones that matter most to people like you and me, are shrinking. And they are shrinking fast. In 2024, over 85% of Medicare Advantage plans offered over-the-counter benefits, things like pharmacy credits and basic medical supplies. In 2025, that number dropped to 73%. In 2026, it is expected to fall even lower. Transportation benefits are disappearing too, vision and dental coverage slashed. And the programs that used to help low-income seniors with food or rent assistance, known as SSBCI, are being cut out entirely by many plans. The government did not force this. The plans are doing it because of pressure. They are under strain from new regulations, rising medical costs, and a rollback of special programs like VBID, the model that let them offer flexible perks during the pandemic. Now that support is gone, and so are the perks. You are not losing your coverage, but you might be losing the most important pieces of it. And unless you go digging through that thick booklet they send in September, you would never know. I get it. Nobody wants to sit down with 30 pages of legal health insurance jargon. But this is the year you have to. Because the moment you show up to the dentist and find out your visit is no longer covered, it is too late. The moment you call the plan, asking where your grocery card went, and they say that benefit has been discontinued, it is too late. It does not matter what the ad on TV promised you last year. What matters is what is actually in your plan today. And this is not just about lost perks. This is about real money. If your prescription copay goes up by $20 per month, or your hospitalization cost triples, that adds up fast, especially for seniors on a fixed income. So here is the truth most people do not realize. Your Medicare Advantage plan has a 1-year contract. It renews every January 1st. But what it covers can change completely. And unless you pay attention, unless you read that notice of change, you might still think you have the plan you signed up for 5 years ago. You do not. This is the year to read the fine print. Because the fine print is where your protection lives, or where it disappears. Every fall, the most important envelope you receive is not a birthday card. It is not a Social Security statement. It is a document called the Annual Notice of Change. Most people toss it aside. Some never even open it. But inside that envelope is your only warning that your health coverage is about to change. It is not junk mail. It is the only place where the truth gets printed in black and white. Here is what it says every single year. Your Medicare Advantage plan will automatically renew, but the benefits costs and provider network may change. That sounds harmless until you realize what that actually means. It means the clinic you have gone to for 5 years may no longer be in-network. It means your specialist may now require prior authorization. It means your prescription, the one that was $15 last year, might now cost $75. And you will not know any of it unless you read that letter. Now let me ask you something. Would you sign a contract without reading it? Of course not. But millions of seniors do it every single year when they let their Advantage plan renew without checking what changed. And it is not your fault. The system is confusing on purpose. The documents are long, the language is legal, but buried inside are sentences like, benefit no longer available in your zip code, provider network modified, transportation benefit discontinued. That is not a suggestion. That is a decision. And once it takes effect, it is very hard to reverse. If you are already in poor health, or if you live in a rural area where doctors are limited, losing a single benefit could disrupt everything. Miss one medication refill, miss one appointment, that is all it takes to set off a chain reaction. So what can you do? First, check your mailbox in September. That is when the annual notice of change arrives. Second, do not just glance at it. Sit down, read it out loud if you have to. Third, call someone you trust, a family member, a neighbor, or even your insurance agent, and walk through it together. If you find out your plan is dropping a critical benefit or raising your out-of-pocket costs, you still have time. The open enrollment period runs from October 15th to December 7th. That is your window to switch to a better plan. And if you do not act, your plan will renew automatically, but you may find yourself in a very different place come January 1st. Remember, Medicare Advantage plans do not have to notify you with a phone call. They do not have to ask for your permission. They just send the letter. And you either read it and prepare, or you ignore it and pay the price later. If you live in a big city, you probably have dozens of doctors to choose from. But if you are in a small town, maybe out in West Texas, rural Pennsylvania, or the quiet backroads of Mississippi, you might only have one. One primary care doctor, one pharmacy, one small clinic that takes Medicare Advantage. Now picture this. You wake up in January, your plan has changed, and the only doctor in town is no longer covered. What do you do? Drive 70 miles to the next available clinic, wait 3 months for a new network provider to open, or pay out of pocket. That is not a choice. That is a trap. This is the side of Medicare Advantage that most brochures never mention. When you are in a rural area, your network is your lifeline. And when plans change providers or eliminate PPO options altogether, you lose flexibility you never knew you were about to need. In 2025, many large insurers already began pulling back their PPO offerings. Some dropped out of entire zip codes. Others merged networks, removed out-of-network coverage, or raised fees dramatically. Now going into 2026, the trend is clear. Plans are tightening, choices are shrinking, and the people with the fewest options, seniors in rural America, are the ones at the greatest risk. Now here's where things get serious. If you are on a PPO today and your plan sends you a termination letter this fall, do not panic. That letter could be a blessing in disguise. Why? Because under federal law, if your plan is terminated, you qualify for a guaranteed issue right. That means for a limited time, you can enroll in a Medigap supplement plan without answering any health questions. No underwriting, no rejections based on pre-existing conditions. You get a second chance. But that chance has an expiration date. You have 60 days before and 63 days after your plan ends to act. Wait too long, and that window closes. And once it does, if you are in poor health or living far from in-network clinics, you could be stuck in a plan that does not fit your needs. So what should you do now? First, if you live in a rural area, look closely at your provider network this year. Ask your doctor, will you still be accepting this plan in 2026 second? If your plan drops your PPO or exits your county, do not throw away the termination letter. It is your golden ticket to Medigap. And third, do not wait until December 6th to start making calls. By then, the lines are jammed, the advisors are overwhelmed, and you are left making life-changing decisions in a 5-minute phone call. The sooner you act, the more control you keep. Coming up in the final section, why all of this matters, not just for you, but for every senior who still believes Medicare has their back, and what you can do right now to protect them. Let us bring this home. No, you are not being kicked out of Medicare. No, there is no mass cancellation of Advantage plans. But what is happening may be even more dangerous. You are being quietly downgraded, slowly, silently, until the day comes when the help you thought you had is no longer there. And for many seniors, that day is coming soon. A missed dental exam, a hospital bill that triples overnight, a ride to the doctor that never shows up. It does not take much to tip a life built on fixed income and limited support. But you are not helpless, and you are not alone. Read your annual notice of change. Call your doctor. Ask questions. If something changes, act early. You have the right to choose a better plan. You have the right to protect your future. And if someone, your neighbor, your church friend, your sister is on Medicare Advantage, share this video. Because they might not know what is coming. This is not just about health insurance. It is about trust. It is about dignity. And it is about making sure that the system we paid into for decades still works for us when we need it most. Leave a comment if you have already seen changes in your plan this year. We are reading everyone, and we are here to help guide you through it. This is Golden Age Money, where seniors are seen, heard, and protected.